The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, this is a hot topic, new treatment options for people with knee pain, with low back pain, hip pain, and even sciatica. With us, we have the spokesperson for Protonics, and it's a system that you put on your leg that is getting amazing results with patients across the country. Ron, welcome to the program.
Thank you. Thank you, Randy.
Okay, now we should talk a little bit about, before we get in, and I have a lot of questions about this, okay? Yeah. And you put this device, this system on me.
Right.
And pretty interesting. Right. So first off, tell us about, now you're a physical therapist.
Correct.
You use this system, this technique.
Correct.
In your center. And tell us a little bit about your center.
It's a physical therapy clinic.
Okay.
It's in Lincoln, Nebraska, and we do a lot of work with looking at posture and anatomy associated with posture. That's a biomechanical way for physical therapists to treat people who are out of alignment or people who are in the wrong position. This system I've been using for 15 years, and the results that I've had with it are results that are unsurpassable when you compare it to other physical therapy techniques out there today.
Okay, let's go to a photo. We have a photo, if you guys could put up the photo. This is the system that goes on the leg.
Correct.
What are we looking at here?
It looks like a knee brace, doesn't it, Randy?
Yes.
It's really not a knee brace.
You don't like when I call it a knee brace because I talked to you on the phone.
No, it's not. Yeah, it looks like a knee brace. It's on knee brace type of apparatus and type of equipment, but it has two modules, and on each one of those modules we have an ability to set resistance that we can vary in terms of how much you get in an arc of movement, a range of motion of movement. That system is used to retrain and reposition your pelvis, your back, your legs, so that you walk and do functional activities in more of an aligned state. So it's really not a knee brace, it's a functional neuromuscular way to retrain and reposition your biomechanical bones, if you will.
Now, we should mention this, and if you're just tuning in, I mean, this is a real interview. I mean, nobody's reading cue cards here. No. This is a legitimate product. Insurance, if your medical doctor were to write for it, can cover it and things like that. But correct. You've kind of dropped the price where people could buy it directly. Is that correct?
That's correct.
From the website, things like that. Let's talk about who's a candidate, by the way, because I made a bold statement. New breakthrough in knee pain, back pain, sciatica.
SI joint, sciatica.
Tell me about that. Who's a candidate for this? I mean, who should take a closer look at this?
You know, people in pain, people who have pain, pain in their low back that hasn't gone away for maybe nagging them, coming and going throughout the week, throughout the year. People who experience pain with their knee joint or across their knee, sacroiliac joint, hip, bursitis and groin issues that come up because of bad biomechanics and the way you alternately work incorrectly, I might add, if you have an alignment issue. People who have had non-success working with professionals like physical therapists, chiropractors.
It means their pain is still there.
It's still there, and they
so
may be on
specifically hip pain or knee pain or both?
Both. Specifically both. When you look at that question, you start to think about it. What came first, the chicken or the egg? Did it really come from the knee that's making you walk and lean and list and torque? Or did it come from a pelvis that puts you in a position that you can't get out of?
And you come from that stance.
That latter stance is the stance that we take with this product. This technique is looking at how to put you in the right position so your spine has a stable base of neutrality to rest on. Your hips are in a position where they can move accurately without one carrying the load.
Now, we took a guy, by the way, before filming, and we won't mention who this guy is. Yeah. We took a guy that had sciatica, okay? We put you on the spot. In fact, we didn't have to put you on the spot. You made this guy use it.
Yeah.
15 minutes, sciatica was gone.
Yeah.
And you put it on the left leg.
That's correct. The pain was on the right.
Okay. Yeah. And what's your theory then, or what?
Well, that's the thing. We conventional medicine and conventional rehab specialists look at pain as
you're a physical therapist.
Correct. Look at pain as if it's coming from the source.
So people are walking with their hips forward or tilted?
Yeah, they walk, Randy. They carry themselves around with a hip.
Okay, this is good.
That has a tendency to go forward. And sometimes it not only goes forward, but it goes forward and stays forward more so on one side than the other.
All right.
And when that
this happens to most people, everyone?
90% of the people out there are walking with a little bit of this pattern because we're a human population.
People with scoliosis, by the way?
Definitely.
Is that right?
Yeah,
okay.
we had your
our makeup artist who's a gymnast.
Who's a gymnast. Put makeup on me a few minutes ago with the right shoulder lower than the left.
You spotted it. You
spotted it right off the bat.
She knew about it too.
And she did. She told me, Mr. Ruska, I know it's not my back that's the problem, and she's got a lot of back pain. Has a lot of back pain. It's coming from my hips, and she's absolutely right. So
you made her lay on the floor. You put it on
the floor. Put it on.
And if you're just tuning in, by the way, this is a real. I mean, I'm not endorsing you. I'm just asking questions today. Yes. But I did see her.
Yes.
Put this on probably 10, 15 minutes.
Yeah. Didn't take that long.
And
put it on. Had her do some hamstring curls.
She had more flexibility.
Her back turned better one direction. Her hips were released, if you will.
So that's a hamstring we're looking at.
Yeah. The hamstring goes from this bone in the back of your hip down to this bone, the lower part of your back.
So this device, the system does what?
This system puts resistance that's programmable across that muscle, making that muscle, isolating that muscle to pull this pelvis back into a neutral position. So when you walk now, the body can walk with reciprocal function that it couldn't before.
Okay, but they wear it. But tell me about this.
Yeah, they put it
on. Okay.
They put
it on. To be adjusted.
And they have two settings. The first setting they put it on is to help establish a new position for their leg bone and their pelvic bone and their hip to work in. Okay. And they do that by isolating that hamstring and shutting off all that negative muscle that they're working incorrectly.
I mean, I've seen it. I mean, it's pretty sophisticated.
And then they put it on.
It's like space age kind of a looking thing. Okay.
Put it on, and they do those curls. Takes you maybe 5 minutes to do that. Then you turn it to another setting called the retraining setting. The resistance is a little different. It's a resistance that's a little bit less felt when you walk around.
I walked with it stiff.
It kind of makes you have to work your
hamstring. I became more flexible. I was able to touch my toes.
After you put it on.
After I put it on, yeah.
And we didn't stretch that muscle out.
Yeah, that was interesting,
by working that muscle, retraining that muscle, you are capable of resuming a normal gait style.
So it's gait we're talking about.
Totally
bipedal. This balances your gait.
Yep. Allows you to walk in a bipedal motion so that every step you take, the engine inside of you, the energy inside of you, the power inside of you, is allowing that pelvis to restore its neutral and natural form.
So you call it retraining. So when you're wearing
constantly retraining,
and your brain is kind of picking up this new movement.
The brain's getting the right information, saying, I forgot about that. Randy, yesterday I didn't have that. Today, I need it today because I'm kind of losing it. My pain's coming back.
So this is for asymmetries. I mean, if somebody's been told they have an asymmetry, one leg is a little bit longer than the other.
Good example.
Okay.
Good example. One shoulder's, their spouse says, honey, why are you leaning today? And the individual doesn't even know they're doing it. Or the kids that are around you at the age of 18, 19, and 20 who are finishing up their growth pattern are starting to show and demonstrate patterns with their trunk that they can't get in and out of. They list, they lean, they hit furniture, they trip. They actually consider it normal when they look a certain odd way, and that is off balance, if you will.
Now, by the way, and chiropractors, the ones that are using this love this. They like it.
Because they understand alignment.
Now,
a chiropractor
we've seen where
alignment.
chiropractors make you stand on two different scales.
Yep.
And I want to make sure I'm understanding this correctly. One leg is always heavier than the other.
Can be.
So
Not always. Can be.
Okay. So by using this, you're saying it balances it out?
Yeah, by using this, by taking that pelvis and putting it in a state where it actually can work like the other side in a functional way. You're allowing your body to treat itself.
But I don't get how the pain goes away, though, in the knee. Let's take the knee. Okay. I mean, how is the pain going away?
Okay.
And what's the connection here? I don't get it.
That's probably the most important question in the whole interview, if you will.
Okay.
This is called the femur. This bone comes right directly out of the hip socket or your pelvic bone or your pelvic area, and it's attached to a bone that's called the tibia, the bone below it. They make the knee.
Okay.
There's a lot of torque going on in our bodies, all over our body. When this bone is not in the right position because of the position your pelvis puts it in. So if I take my pelvis forward, this bone follows that orientation of that opening that the bone is in.
Okay.
Now this bone is now inwardly oriented. It's not inwardly rotated there, it's inwardly oriented. When you put your foot on the ground, the tibia is neutral, but it's under a bone that's inwardly oriented.
So
the torque on that knee.
So it's like twisted a little bit, slightly?
Tension.
Can they prove that with x-rays or things like
Absolutely,
that?
we've done it already. We've done a fluoroscopy study that actually showed it to you.
So the pain goes away how
So
soon,
you
by the
pull
way?
the pelvis back, the hamstring gets that femur lined up with it, and pain is gone, in some cases, instantly.
In your clinic, and I want to make sure because we may have to have disclaimers all over the place on this show.
That's fine.
But in your clinic,
Yes.
big center in Nebraska,
Yeah.
do you have people that go in with knee pain, they've suffered knee pain, and within days?
Within
a week?
hours, within a minute, they'll walk out with knee pain. If this
They
kneecap,
say that to you?
oh, well, they don't say it. We know it. They tell it.
I mean, they tell you.
They do say that to us, but they also, we know it because their functional performance now goes up because they don't have that antalgic type of pain, that pain that's there with everything they do, that's gone.
So now you're able to use your glutes properly?
Your glutes, you're going to be able to shut off your calf muscles that you overwork too hard. You know, a lot of women coming in with these calf cramps and tightness because of the shoes they wear.
Have you ever had people with low back pain that this has reversed it? I'm asking for real stories where people...
Absolutely.
Really?
You know, that's when I think about the system and not having it available. For the 60-year-old man who's playing golf and really hasn't had any success with any flexibility.
They get a lot of knee pain, these guys.
A lot of back pain, too.
Okay.
And they come in and they put this system on and it's instantly gone.
We're going to take a quick break. We come back. I want to know a little bit more about the science.
Okay.
Okay. And if they go to protonics.com, you have some of the scientific literature there.
Some references they can go to.
And you have medical doctors that back this.
Yes,
Presidents
we do.
have been fitted for this. You have celebrities that use this. It corrects your gait.
It helps restore your gait by repositioning your pelvis so that your function can be more reciprocal.
Is this patented? I mean, are there other...
Yeah,
who's your
it is
competition
patented.
on it? Really?
There is nobody else out there that does this. That's what's so neat about this science. Is that it's
When
the
does your
science
patent
story.
run out? Is it coming up
I don't
soon?
even know. I couldn't even tell you.
Okay.
I couldn't even tell you.
That's right. You're not part of the company. I mean, you're their spokesperson in this
couldn't tell
particular
you.
case.
Yeah.
But very interesting. And the main thing is, you say, Randy, it's about pain.
It's
it
all
gets
about
rid
pain.
of pain.
Absolutely.
You see it every day, every week.
Every time it's put on, you will see a reduction
But
in
aren't
pain.
people skeptical?
Of course they
See, because
are.
I don't have knee pain.
Yeah.
So it's not an issue with me.
A lot of people don't have pain, but they have patterns they can't get into and out of.
But the people with knee pain, that crowd, or hip pain, do they understand? Have they been told by somebody
That's what's
that their
so
gait is
nice
off?
about this system. They get it faster than the professional does. Because they understand that your makeup.
She's also our hairstylist as well.
Was a gymnast.
Yeah.
She knows the pain's coming from someplace else. These patients know that pain is not coming from that side. They know it's related with activities, sitting, standing, sleeping. It's related to a functional activity level that generated that pain.
Who is this best for, by the way? I mean, who should really get one? Somebody with early knee
onset knee pain would be ideal. Someone who has, and I always look at the individual who has this ongoing. Idiopathic is a word that just kind of generates on its own. It comes on its own over time. Idiopathic pain.
You weren't in a car accident?
No, you weren't in a car accident, no trauma, no surgery, no neuromuscular disease. All of a sudden, pain's for no reason at all. It just comes on. And that's usually after maybe you've had a hard week last week, an easy week this week, and you're still in the pattern you had last week.
It's very interesting. It's very interesting. Okay, we're going to take a quick break and come back. More about the science and walking us through this process.
Love to.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you have knee pain, hip pain, or if you've been told you have an asymmetry, you have to listen or watch this next segment. We'll be right back.
I put this device on, and immediately I had no pain. It was amazing. It was a godsend for me. I knew then that I was going to get my life back. It was just a matter of time. So when I first put it on, I wore it 3 times a day for a couple of hours each time. And I noticed right away that my pain subsided. And as I've gone along wearing this thing, I've gotten to a point where I wear it maybe once every 3 months or so, just to bring my pelvis back into alignment. I noticed right away when I did gardening or anything that had me bending over or bending forward for any length of time, that those are the things that aggravate it, and that's when I need to reposition. Put my pelvis back into alignment, and then I'm good to go. No pain. No pain.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We're talking about knee pain today, hip pain, low back pain, and a new system. It's patented, Protonics, and in some cases insurance. In fact, if a medical doctor, I guess, writes for it, it'll get covered, prescription. And you've sold thousands of these. Is that right? Now, you're
I haven't. The company.
The company. Now, you're the spokesperson for this.
I'm a one of, yeah.
You're a physical therapist.
I'm a physical therapist.
You have a big center in Nebraska, and you use this
a lot,
all the time.
Yeah.
I mean, on everyone. I mean, do you tell?
No, not everybody, but I use it on individuals who I need to use it on, who I know that if I don't give them some quick results of reducing their pain, I may lose them.
Okay, before I get into the science, and I think maybe I'm more into the science, wanting to know how it works, than maybe the person watching this, but give me some stories of people, a few of them.
Sure.
Like, that you see.
Well,
use it.
I'll try to stay off the operative stories because they're countless. I'll stay with
operative meaning?
Operative meaning they've had surgery.
Okay. So somebody that's had surgery can use this.
Absolutely. Some of the best orthopedic physicians that we work with understand the importance of the system. In other words, they know that there was a mechanical issue that brought their symptoms on and brought problems and trouble to their knee or their hip. And they want to make sure that after you get through the surgery, everything stays aligned and swelling stays down and strength comes back fast. And so we have a lot of orthopedic physicians, especially.
What about chiropractors? They're really into this. They always come on.
They are.
I mean, do they like it, the ones you're showing?
Absolutely.
So they endorse it?
Company, strongly.
Orthopedic surgeons?
Endorse it.
Endorse it?
Yeah.
Okay, good.
And probably the one person that endorses it more than anybody is the general public. The public who uses it goes to their orthopedic doctors and say, hey, have you heard about Protonics? And if the orthopedic doctor doesn't know anything about it, here this patient is telling them, get on the website, here's some information on it. My Aunt Martha had it on, and I got to tell you, she had the quickest results of anybody I know. So it's really the general public that's going to the physicians.
Are there people with chronic knee pain that report, I guess on a scale of 1 to 10, they maybe use that scale, that they go to a 5, they go to a 4. I mean, any zeros to any say?
That's where I use it the most. When I get to a point where I can't get somebody aligned and stay there, I don't know what I'd do without it. We have some men who come into the clinic right now. A testimonial will be a guy coming in the clinic just a few months ago says, without this system, I can't move. I've done everything. I've taken my leave. I've taken my anti-inflammatories. I do my exercises every day. I wear good shoes. I try to stay active, but I can't get out and walk. I put this system on and I go for a walk. Not only am I getting good exercises cardiovascularly with it, I come back and I feel lighter. I feel looser. I feel like I just got a major workout just walking.
Because Protonics, you say, means something.
Programmable isotonic movement. There's isometrics in life where you take two surfaces and move and nothing moves.
Okay.
There's isokinetics where you have speed driving the resistance. The faster you move, the more resistance you get, often seen in rehab facilities, physical therapy clinics especially. And then there's this isotonic concept that's been around there for years. Every time you pick up a dumbbell, you're getting a muscle to fire isotonically, which means the movement, as you get into a range, that movement will produce resistance because of gravity.
But this is Protonics, so the
Protonics is programmable, which means I can set the amount of resistance you get. I can integrate it by giving you a recruitment pattern that isolates specifically the muscle, keeps you in the right position.
Okay, so golfers, athletes, especially people in pain.
Area.
Especially people in pain.
Especially golfers and athletes who are in pain.
So this is the new. Now,
golfers like it because
it seems
they can
so
wear
simplistic. By the way, I mean you have the science behind it.
That's what's cool. As I flew out here, Randy, I keep thinking to myself, we've made this so complex. We have such a complex society. This is one of the most simplest designs we've got in our body. That is, realign yourself, reposition yourself, restore yourself, revise yourself. Reevaluate every day what you're doing and not doing. This allows you to do that revitalization on a daily basis. With the thing we should be able to do besides talking, we need to be walking. And that walking
So when you walk
critical.
with this system on, it corrects these asymmetries. The scoliosis crowd, you say that this is...
that's my personal love. I love talking about the spine.
So the asymmetry,
the asymmetry of your rib cage is influenced by it. Your diaphragm knows it. The diaphragm attaches right down there with those hip flexors of yours.
So to buy it, you go online.
Yep.
And if there is a doctor in their area, they can see one of the doctors. That will also be listed on your website. And I'm skeptical, by the way. Is everybody skeptical?
Again, the people that are skeptical are the people that have gone through so much rehabilitation that it's a little bit frightening when they actually don't have the pain. Do you follow me? When they actually feel it go away. What happened? And then once they understand what happened, they get it very quickly.
Protonics has sold thousands of these. Mm-hmm. Do you mind me asking, have there been any returns that you know of?
Not to my knowledge, Randy. I don't know one that's come back.
Now, doctors will watch this show. Orthopedic surgeons will watch this show. Okay? What do you want them to know about this device?
That complements their work. It complements their effort. It complements their thinking. Orthopedic doctors are excellent at understanding when something's not working because of a malalignment or because of a disease that's encroached upon a joint, because of inflammation, because of poor mechanics. They're the best. And when it comes to looking at the causative issues, they understand that as well. Orthopedic physicians
So this goes to the underlying cause, you think?
Absolutely.
So you're no longer overcompensating by putting more pressure on the knee?
You're lining things up a little bit better so things can work without having that joint effusion.
Now, hip pain, by the way. Mm-hmm. Is that ideal? We talked about the knee.
The number one cause of hip pain is surfaces that are banging away on each other. When a joint can't move within a joint because of the joint's position, and you still want the same activity out of the extremity that's coming out of that joint, if that joint cannot get in the correct position, things start to bang around and they start to wear out. Groin strain and
What if they have arthritis and things like this, by the way?
Natural causes and conditions like arthritis. What's the first thing, Randy, we want to do if we have a joint that's in an arthritic condition?
What?
Unload it. Get it lined up.
Unload it?
Unload it.
So if you have arthritis in your knee, using this system it'll put less weight, it'll balance
less pressure, keep it symmetrical. And so all the uneven surface hitting and contact, premature contact, that's contributed because of this forward inclination of this pelvis, can somewhat be resolved by getting that pelvis back into its position.
Knee pain and neck pain. Let's talk about early people that are just starting to get early knee pain early. And those people are, I talk to medical doctors, they say they're headed for disaster if they do nothing, because it gets worse, because they have to overcompensate to avoid pressure on their knee. If everyone knew about this across the country, medical doctors, orthopedic surgeons, are you convinced everybody would do it?
I'm convinced anybody who had a problem that was treatable because of poor position would immediately put this on and immediately feel the success with it and would immediately want to keep it.
Okay.
If there's issues that require surgery, if there's issues that require medication, that this can't handle, now you know.
Have you ever had anybody that was scheduled for a knee surgery that used the system and canceled it?
Absolutely.
Really?
Especially with the back.
More than one?
More than one. And I don't keep track, Randy, of these things.
But more than
over the last 15, absolutely. I can actually tell you more than probably 50 in my life right now, at least, of back people, surgery, scheduled people, putting things off until they were sure that the position that they should have been in before they had that surgery could be.
Do you have people that have been wearing this for 10 years? 5 years?
Yes. I know one person right now is on their 17th year wearing it. And it's kept her walking every single day of her life without pain in her life.
It's good stuff. Okay, we're going to take a quick break. We come back, more about how to order it, how to find out the science behind it, and how it gets fitted in their home. You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Up next, more about how to get out of knee pain, hip pain, sciatica, low back pain. We'll be right back.
I was having a lot of back pain, and my sciatica was really painful. And I discovered heard about and discovered the Protonics. I was shown how to use it and given exercises, 2 exercises to do twice a day. Since I have been using the Protonics, my pelvis is back into alignment. I have found my sciatic pain is no longer painful. And also, one thing I have really noticed is my posture has improved greatly. I stand up much straighter than I used to. I use the Protonics just to do my regular housework, ironing, going up and down stairs, vacuuming. I highly recommend it.
You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're talking about new breakthroughs in the treatment of knee pain, hip pain, and low back pain and even sciatica. With us, we have a physical therapist, spokesperson for probably one of the nation's hottest new companies to look at, Protonics. Okay, you make this system, and we really are tight on time. A recap. Somebody that has this pain.
If you're a person who has pain at the knee joint, at the hip joint, the low back, in the SI region, in the groin, and you can't walk comfortably with that pain, you can't do your normal daily function with that pain, and you don't really know why. In other words, you've gone to a physical therapist and they think you've got you on the right track. Chiropractor, physician, and it's not going away. And it's coming from my heart. You know, okay. Randy, this is coming from my heart. This is a system that will make sense to you once you feel and find that specific muscle that keeps you in that state where you can finally work without all that need to have pain.
Do you see reversals in pain every day, or every week, I should say, in your clinic?
We do. We absolutely do. And again, I don't say this lightly. When we get patients from all over the country, and when they come in and I need this system, I can pull it out, put them through this program. They now know at the very least that they're in charge of their own day-to-day activities with something they can do by themselves at home.
Easy to put on. Creates helps this asymmetry.
Helps you develop a normal rhythmic pattern with normal type of symmetry that your body doesn't know how to keep.
And what's the expression?
We have an asymmetrical body.
You call it retraining and something else? What is
Repositioning,
it?
Retraining.
And so the neuromuscular
ability is coming through the retraining process. The repositioning is showing you how to isolate, inhibit muscles, and turn on muscles, facilitate muscles that you didn't know were there.
Okay, Protonics. You've made it affordable. You don't have to wait around for a prescription.
No. And it's easily applied. You can put it on yourself. You don't need to go into a physical therapy or chiropractic clinic or physician's office to have this put on. You can do it yourself.
Well, thank you for coming on. Good stuff. We're out of time. Very good. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again, maybe you popped in 10 minutes, you can go to our website at wellnesshour.com. Just put in pain. You can put in Protonics. You can put in low back pain, even sciatica, if you could spell it, I guess, and you'll find it there, and you'll probably have it on the Protonics website. They've got it's affordable, and again, this interview was a real interview, not to endorse you.
Correct.
I tried it on, and it made a difference already. That's this week's Wellness Hour. We'll see you next week.
Thanks for watching The Wellness Hour, the leader in medical news, with your host, Randy Alvarez, the authority on health issues.
Hi, I'm Randy Alvarez, host of The Wellness Hour. We are currently looking for licensed health practitioners to be on the show. So if you have something to say, a great message, a new breakthrough, you have to let us know about it. Visit wellnesshour.com, click on how to become a guest, or just email me directly at randy@wellnesshour.com. If you know a doctor that you think would be great on the program, send them my way. We'll see you here.